We're thrilled that you have joined the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m., so please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for every meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for questions our attendees may have. We ask all participants to remain muted during the presentations. When we open for questions and answers, you can unmute to ask your question, or you can type your question in the chat and we will ask it for you. Without further delay, I'm excited to introduce that the 3 agencies for today are UAB Beacon Recovery, Lovelady, and Central Alabama Wellness. At this time, we will begin with Courtney and UAB Beacon Recovery.
Hi, so I am Courtney. I am with Beacon Recovery, and we also have Dr. Leah Leish on here. Are you able to come on, Dr. Leish? Okay, she is driving right now, so
yes,
we're gonna go.
I'm here.
Okay,
I'll turn my camera on in just 1 second.
You're good. So Beacon Recovery, we are an outpatient treatment program. We're a fully integrated program. We're a state-funded facility. We're funded by like the SANSA grants, and we offer outpatient counseling, ACM assessments for adults and adolescents, and we also have a clinic. And this is some of the staff that we do have that work pretty much with every single patient that we have with us at Beacon. So they get a lot of help from all sides when they are with us. We have a few different levels of care. For adult, we have IOP, and then our outpatient, and then we also have early intervention. And we do the ACM assessment as well for adults. I accidentally deleted that off. For adolescents, we have the IOP, the outpatient, and we also do ACM assessment, and we'll make all those referrals. We do have a lot of translation services. We have a we have actually quite a few Spanish translators available to do the assessment and to sit through all the groups and help clients throughout their whole journey with us, whether it be a doctor's appointment group, whatever. The translators are there. And this is kind of like a really quick overview of Beacon Recovery. I don't know, Dr. Leish, do you want to jump in at all?
Sure.
Well, Dr. Leish, I think we're having a hard time hearing you. So I have this broken down. Dr. Leish is getting better service. I have this broken down into kind of 3 sections. Beacon Recovery is our counseling program as a whole. That is the program that's been around since the 70s. It started out as TASC. And in Beacon Recovery, people can be enrolled in Beacon Recovery. Dr. Leish, we can't Okay. Hey, Dr. Leish, we can't hear you. Whoops, not gonna come over here. But Beacon Recovery, so that's our counseling program. We refer out people who have insurance that will pay for treatment. But if someone is underinsured or does not have insurance, they're eligible to come to Beacon Recovery and be a client there. Except for Medicaid, they are allowed to be in our program if they have Medicaid, our counseling program. Beacon Integrated Healthcare is our clinic that is there for people who are enrolled in our counseling program. And as long as someone is enrolled in the counseling part of our program, they're eligible to come to our clinic if they do not have insurance. If they do have insurance, we do have to transfer them to a different healthcare provider, but we do have medication for opioid use disorder. We have medication for alcohol use disorder. We have primary care physicians, which is Dr. Leish. She's also a medical director who's on the phone, and she's crazy busy. And so she's actually driving to Florida right now. So she's having a little technical difficulties. But they're eligible to come to our clinic, and as long as they're enrolled in our counseling program and our clinic, we do pay for their medications. It's all at no cost to them, with the exception of their MOUD, which is medication for opioid use disorder. After 6 months, the funding for that kind of goes away. So they normally will have to start paying for their medication then, but we prepare them for that. We work with them to get there. And so, and they also have a designated care coordinator, case manager, who is awesome, who works with them to help with things like dental, health insurance, if they have warrants, just anything that they may need. And then Beacon ACT Clinic is our newest clinic. The ACT stands for Access Connection Transition. It is basically a opioid use disorder urgent care. We are a walk-in clinic. We do not need referrals. If you know you're sending someone, you can shoot me an email. I'm going to put contact information in the chat, and I think it's on my next slide. I am the care coordinator for the ACT clinic. I also do a lot of peer support services. I'm in recovery myself. But this clinic is very unique to where any person can come in off the street. They do not have to be enrolled in Beacon. It does not matter if they have insurance, if they don't have insurance. The only requirement is that they have opioid use disorder. And they have to show up during our walk-in hours, which are 8 to 10, Monday through Friday, every day. If they cannot come to those hours, they need to call me. I can make an appointment. But at that appointment, they will get an assessment. We'll refer them to care same day. They will get medication that day if the doctors deem it appropriate. And we pay for their medications. For their first and second visit in this ACT clinic, they're given a total of 3 visits, and those 3 visits are used to connect them to long-term care, whether that be Beacon or a residential program or somewhere else that accepts their insurance. And I know it's a lot, and it gets confusing even for us here, with having so many different programs and stuff like that. It's just basically funding sources that separates them all. This is the contact information. This main line, that is the number to call if they want to get enrolled in Beacon Recovery, if they want an assessment, anything like that, their email's also on there. And then the Beacon ACT clinic, which is our walk-in clinic, all of that information's on there as well. I'm trying to, I was trying to speed through it because Dr. Elisha's going to talk. But does anyone have any questions about what's going on? I was going to talk about the counseling stuff. She was going to talk about the medical stuff, but what can I help with if anyone has any questions?
If you have any questions for Courtney, you can put those in the chat and I will ask for you, or you are welcome to unmute and ask her yourself. And also, what we can do is if we have a few minutes in the end, we can loop back around if she has better service and is able to sign back on. We'll just do that.
Okay, I'll let her know.
Perfect. So if no one has any questions at this time for Courtney, thank you so much for sharing. We appreciate you being with us today. We will move along to Lovelady, and we have Frank Long on the call.
Good morning. Thank you all so much for having me and hosting this. This is just critically vital work you and the task force is tackling. In this era of the opiate crisis, pandemic, whatever you want to call it, it really has to be a treatment plus recovery approach. And there's a lot of providers doing great work in the state of Alabama. In fact, I want to credit Beacon because I went through that program myself. And also we've been working with Dr. Elisha closely to tackle some MAT related issues. But let me get to the Lovelady Center. So it's truly the honor of my life to be able to represent the more than 600, actually more than 700 current clients, staff, and children. I like to say that we're the best kept secret in Alabama, not among our clients, but among the average person, because most everybody in Birmingham and statewide has heard of us. Sadly, when you talk to people, most people just simply think we are a thrift store and they're not familiar with what those two thrift stores support. Now, if you've been to our two thrift stores, God bless you. Thank you so much, because we are privately funded and those stores provide almost 60 cents of every dollar we need. This year we'll need about $11 million. So we operate on a shoestring budget. But I'm going to try to give you the 30,000 foot overview in the next 10 minutes to tell you about our program, because we are super proud of our program through 20 years of trial and error. We feel like it's very comprehensive. So the idea was we started as a prison ministry, taking women out of Julia Tutwiler Prison. And our founder started that back in 2005, taking women into her home before they completed the remainder of their prison sentence. We have quickly grown into the largest long-term recovery facility for women and their children in the United States. As of today, as of this morning, we have 471 adults living at our facility and 140 of their children that we're taking care of this summer. So when I say long-term, I'm referring to programs over 90 days. Our program is actually 9 months to a year and a half. 9 months is the shortest amount of time you can graduate the program. So all of our women are sent to us for various reasons, mainly addiction, incarceration, domestic violence, and homelessness, or some combination thereof. Oftentimes we see women that suffer from all four of those conditions. So when I mention incarceration, we still have the only supervised reentry program from Tutwiler Prison that's not for profit, meaning if you have between 6 and 12 months left in your prison sentence, you can serve it at the Lovelady Center. So even though 80% of the women are justice involved, meaning they have an open case somewhere, whether that be DHR, a drug court, about 50% are court ordered. And I even use that term loosely. It doesn't necessarily mean 50% of the ladies are brought to us in handcuffs. It means that it could be your community corrections, could be your parole home plan, could be you were sent there by a drug court, or it could be you're brought straight from a county jail or prison in handcuffs. The other half are self-admitted. So self-admitted could be your mother from Mountain Brook drops you off, could be the Birmingham Police Department drops you off, could be JBS drops you off. Those happen, all those instances happen more frequently than you think. So if you're dropped off with only the clothes on your back, you are given everything you need to succeed the entire time you're with us. And then afterwards, starting with clothing, we'll take you to our thrift stores when they're closed on Sunday and let you go shopping. We don't ever want to hand somebody a uniform. We consider ourselves a whole way house. We're the opposite of a halfway house. We focus on the mind, body, and spirit. Now, everything we do at Lovelady is rooted in the teachings of Jesus Christ. Now, our motto is simply love, to show these women love. So we try not to get into doctrine or controversy. So I'm going to talk about the program for a minute. So the program has 3 main pillars, or if you have your children, 4 main pillars, and you have to earn credit hours in all of these pillars. The pillars are class credits, education credits, health credits, and like I said, if you have your children, parenting credits. So every 6 weeks, and throughout the year, we have 6-week mini-mesters. We offer between 40 and 60 classes. Now, many of those classes are studying the word and scripture and overcoming. Others are evidence-based classes like conscious discipline, epic parenting, anger management. There's always a bank in our building teaching financial literacy. We do a lot of Celebrate Recovery, a lot of relapse prevention. So when a lady first arrives, after her 3-day orientation, where she is getting used to meal times, med times, our staff, and where her classes are going to be taught, she's then sent to either the phase 1 dorm or the restoration dorm, both of the most restrictive, meaning no cell phones allowed, more staff down there, because oftentimes we're meeting ladies at their most vulnerable point. And if she struggles with substance abuse, she is put in our SAP program, which simply stands for Substance Abuse Programming. We plan out every minute of her day from 8 a.m. to 8 p.m. when she's in that first phase. After the first couple weeks, we let them get settled in because often ladies are still feeling rough being separated from their substance. After that, when you earn the necessary credit hours, you can phase up to phase 2. Now, our program has 5 different phases. And like I mentioned, 3 different pillars where you're earning credit hours. When you phase up to phase 2, a number of things happen. Number 1, you move up to your own bedroom. We try to put 2 ladies in a room. We have 207 bedrooms. We're housed in an old hospital that is 280,000 square feet. So it's perfect for what we use it for. Let's see. Another important thing of phase 2 is you are assigned a job readiness. So it's not a paid program, but it's a job readiness or job training program. So while you're at Lovelady, you're expected to work, and you're going to work for us. So you either work at one of the 17 departments in our building or one of our 2 thrift stores. Now, the beauty of the job readiness, other than the soft skills, the accountability, and the sense of community that it teaches, is if you graduate our program in good standing and you want a job, we'll hire you. So we've got 144 full-time employees. 88% of them are graduates of the program. So I'm one of the few men getting to grace those hallways, and such an honor because I myself am in long-term recovery. All right, so I talked about the class credits. I'm going to talk about the education credits real quick. So we have an education department where every single lady gets an education assessment. And what we're looking for there is to see, we have higher rates of illiteracy than most populations. So to see if we need to get you in some immediate tutoring. We're also asking, do you have your GED? If you don't, it is Lovelady law that you are going to sit for portions of it. So last year we got 25 GEDs. If you do, we try to plug you up with fast track programs, certificate programs. We offer a lot of these in conjunction with Jeff State, Lawson State, Central Alabama Community College. Welding, paralegals, real popular. Another thing we do is UAB comes in and teaches computer basics and computer lit 101 and 102. We also offer the ACE certification, the work keys, and we work with a great nonprofit called Work Faith Birmingham that comes in and gets a resume for each lady, teaches them how to dress, does mock interviews at outside HR departments. So the education department is doing great works. The other credits are health credits. So we have a fitness center at Lovelady. And even though we have a population from a few days old to their late 80s, if they're physically able, they have to be in the fitness center a certain amount of time per week. If they are not physically able, they still have to meet in our devotion area to do stretching classes. They do oral nutrition classes with our dental hygienist. Nutritionist comes in. And so the health credits, you also have to earn 34 of those. And then lastly, if you have your children at the center, you have to earn 34 parenting credits. Now, some of those are very simple. Do you have their birth certificate and social security card? Others are things like, have you taken all the DHR approved parenting classes? Others are, have you been to recent medical and dental visits? So that kind of touches on the 4 pillars. We offer a lot of evidence-based continuums of care and a lot of wraparound services. We have 13 client reps, we call them, or case managers. We have a counseling team of 10. If you've never been to Lovelady, there's a minimum of 9 counseling sessions before you can graduate. If you've been there before, a minimum of 16, because we want to get to the root of why you keep coming back. As part of that whole way house model I mentioned, one of the things we quickly realized, or our founder realized when she started doing this work, is that dental care is so important, right? So we have a CODA accredited dental clinic on site where we currently have 10 dentists in partnership with the Foundry that rotate through, and 5 oral surgeons and a full-time dental hygienist. So the first thing we do is get the ladies out of pain. The second thing we do, if you can't smile, you can't get a job. So far this year, we've done 82 pairs of partials and full pair of dentures, all at no cost to the ladies. Also, because Alabama refuses to expand Medicaid, only 14% of our population qualifies, and that's the ladies who have children who are under 5 years old living in the center. So for the rest, we have volunteer general practitioners and psychiatrists, as well as a great partnership with Christ Health. We pay for all their over-the-counter and prescription medication at a significant cost. Another thing we do is provide transportation. So none of our ladies will drive the entire time they're with us. Therefore, we have, I think, about 20 vehicles. And last year we drove north of 1.1 million miles, taking them to court, medical visits, DHR, to get driver's license, to and from the Clay and Irondale thrift store. And we have a school bus that takes our 5 to 12-year-olds to Miracle Academy. It's a private Christian school with an emphasis on dyslexia and trauma. Another thing we do is we serve meals. We serve 1,800 meals at the center every day. So that'll be nearly 600,000 meals this year. So the kitchen has 42 ladies on their job readiness and is led by an absolute angel. She's a retired English teacher from Hewitt Trustful. Her name is Miss Dee Dee. She was simply teaching a cooking class 7 years ago on the 4th floor and somehow got roped into running that whole operation. But we try to offer healthy options because the ladies are there long term. So, you know, I'm told frequently in conferences and best practice type places, a good development director has a really good elevator speech. I've yet to find mine. My elevator speech is, I invite you to come see what we're doing. Please come visit, because it's a lot. You know, our wait list right now is between 250 and 300. We get between 10 and 17 applications every day of the year. Now that sounds overwhelming, but y'all know, because you work in this field, that when you tell somebody with substance use disorder, hey, you can come on a Wednesday in 2 weeks, maybe a fourth of the people are going to show up. So the key to us is persistence. Once you fill out that online application, staying in touch with our intake and whoever is assigned to your case, because we do prioritize based on situation, those fleeing domestic violence. Maybe a heroin addict gets priority over an alcoholic just because they're less likely to actually make it to us. Those coming out of jail and prison get prioritized. So even though the wait list sounds daunting, usually we can work through those lists in a matter of weeks. And if we have an empty bed, we get people in. I mean, our beds stay full, and we always have at least 450 women. And since 2004, we've served over 15,000 women and 4,000 children. So, I see a lot of friends on this call, and I just so appreciate y'all's time.
Thank you so much for sharing. At this time, we'll open it up for questions for Frank with Lovelady. All right. Thank you again for taking time out of your day to share with us. We greatly appreciate it. And this sounds like a wonderful resource that is available within our state. So at this time, we will move forward to Gabrielle with Central Alabama Wellness.
Hi, thank you. I'm gonna go ahead and share my screen so I can get it all pulled up. So this is, y'all should be able to see the screen that has CAW on it. We call it CAW just because we use lots of acronyms here. There's lots of acronyms that you use in community-based, but Central Alabama Wellness, a little bit about us. We are a 501c3 community mental health organization serving the Central Alabama area, formerly known as Chilton Shelby Mental Health Center. That changed a handful of years back. And we've been serving the local community for about 52 years now, since 1972. For mental health and substance use, we serve the Shelby and Chilton counties. And then for our intellectual disabilities division, we serve an additional probably 3 to 5 counties. I think it's a total of 7 or 8 counties total. Going into kind of the services that we provide and the different levels of care. So looking at our mental illness division, it's anybody that's age 5 and up. It's primarily, we are a therapy-based organization. So for individuals seeking just psychiatry, we'll talk to them about that and see what the needs are medication-wise and make the appropriate referrals. But if they're here for therapy or therapy and medication, we got them. We see people with insurance, without insurance, it does not matter. As long as they are, they fall into our seriously mentally ill or SMI category and they're within our catchment area and they don't have insurance, we can put them on a sliding scale. But even then, if let's say a client's struggling to be able to afford services, we're going to work with them no matter what. But we also accept almost every single major insurance as well. Psychiatric services, we have currently 2 providers that are housed in our Pelham office. And then the other parts of the mental illness division that we have would be our residential and group home. That's also our permanent supportive housing division. So this is a handful of group homes that we have for, again, SMI individuals. And we teach them basic living skills. We help them, regulate medication and try our best, especially if they're in our permanent supportive housing side of our residential services, to get them reincorporated back into the outside population and set them up for success for that. Some other things that we do, justice involved services, we have our Stepping Up program for our adults. It's case management, therapists that will go and work with them. Right now it's our case manager that's going out there. And then also we have 2 therapists that work with our child and adolescent groups, our juvenile court liaisons. They go to the detention centers, they work with New Direction and, provide group therapy and individual therapy for those clients as well. Our ACT team and our in-home intervention, these are our kind of next step up. We think of our outpatient as like a level 1, and then in-home is our next step up for more frequent in-the-house visits. And then our ACT team is multiple days a week in-home visits. And that's our therapist, case manager, and for the ACT team, a nurse as well. We also have outpatient level case management, as well as peer support, prevention services, domestic violence and anger management classes. A lot of times those are court referred. However, it doesn't have to be. They just need to call our agency and ask some questions of how they can get that set up. And then the last one on their school-based services, we have a couple therapists that go around to the different schools, just to kind of bridge the gap. That way, we're not pulling kids out of school half a day to go see the therapist in the outpatient level. Our substance use program is for adolescents in our Pelham Center, only for the adolescents. And then every center that we have, North Shelby, Pelham, Clanton, Mitchell Center, all of those see adults. And it is level 1 outpatient therapy and peer support. And we also do some early intervention, as well as just kind of collaborative care. So if someone's on the wait list for a higher level of care, we're going to keep in contact with them and make sure that they're doing okay as best they can. And then next one on there, we have individual placement and support. So this is our vocational services. We have benefit specialists and employment specialists, as well as peer supports that work with clients to help them gain competitive employment. And they also advocate on behalf of our clients. We have clients that maybe are on disability and don't think that they can work, or they have said, I think of cases in my mind of where clients have said, my mental health is too bad for me to be able to work. And our IPS team is very good about advocating for the employees that no, just because we have a mental health issue does not mean that you can't work. If you want to work, we can collaborate with you. And the last one on there is our Intellectual Disabilities Division. This one provides case coordination across multiple counties across the state of Alabama. And the wait list for this one is a bit lengthy because there's not a lot of ID services in the state. However, they will send case managers out there depending on the severity or the needs of the client once a week, every couple weeks. Some of them are a little bit more spaced out because they're kind of established, but they act as our advocate for the clients, and they also help connect them to different resources and, continue Medicaid, ID waivers and things of that nature. So like I was saying earlier, we have outpatient services for mental illness, substance use, and child and adolescent. We also, our intensive services would be our ACT team and our in-home, as well as our IPS team. And then the residential services is the group home and the permanent supportive housing. So looking at referrals and admissions and some exclusionary criteria for clients, if they are not referred to us, that's no big deal. All they have to do is call our main number that's on this slide and press option 1 for new clients or access to care. We try to make the entry as easy as possible. They'll just answer a few questions on the phone with one of our access to care admins, and the admins will either say, hey, we have open access, which is where our clients can walk in on Wednesdays from 8 to noon and get an intake done. It's first come, first serve, and I'm going to talk about that a little bit later. Or they'll say, would you like an appointment scheduled if a client doesn't want to do open access? And they'll get them scheduled, and that's how they would start their services. Once the client has the intake done, then we set them up with either an outpatient therapist for mental illness or substance use or whatever the client is coming seeking services for. For any kind of providers, hospitals, other organizations that are referring the client, they can email their referrals to our records department, and the email is on there. It's records@centralalabamawellness.org, and then the records department will let our access to care people know, and they'll reach out to the client. Let's see, and we just kind of go from there. So again, as I mentioned earlier, we work with individuals 5 and up. Variety of services, and I know I said this on the last slide, we are a therapy-based organization. So if they're coming solely for a medication, we're going to have a chat about how we don't do that. We have therapy, and then we also have psychiatric services as a supplement. Some exclusionary criteria: anybody that's under 5, an individual with a primary diagnosis or only diagnosis of autism spectrum disorder, intellectual disabilities, there should be a little asterisk there, or any kind of major cognitive impairment impeding the client's ability to participate in therapy. I say there should be an asterisk next to intellectual disabilities because we do have an ID division. When I say that that is excluded, it's for our MI therapy or our substance use therapy. So we could still get them set up in the organization, but it would just be strictly for that ID division, not for MI or SU. Any client needing a higher level of care, we're gonna do check-ins, case monitoring until we can get them to that higher level of care, just to try to ease the transition. And also we want to make sure our clients are okay. And then any client with a Z-code diagnosis, we can't see them. It just means that there's no diagnosis, there's to be worked on. Sometimes we get referrals from court or CROs or things like that, and they're just saying, hey, we want to check on the client, and our therapist will do an intake and say, yep, not finding an issue, here's what I found. And so that's where that Z-code would come in. Some additional information: I talked about open access a little bit, but it is every Wednesday. Clients should be arriving at 8 a.m. because it is first come, first serve. Our hours that we do open access are from 8 to noon. However, if you show up at 11:30, I can't guarantee that we're going to have a therapist available to do the intake. If you show up at 8, we can get everybody situated and say, okay, yep, we can get you in at this time and this time and this time. If they want to put their name on the open access list to just give us like a heads up that they're planning on coming this day, totally cool. They can call our access to care line, but it's not required. They can just walk in on open access day to come in for appointments, or for first come, first serve appointments. And then for our ID services, I mentioned it before, but it is case management only. I wish we had more services for everybody. We don't. All the services we want to do, we just don't have enough people. We always need more people. And I think there's always more that we want to do for our clients. Okay. And if there's any questions, feel free to let me know. And that is our main contact number on the page.
Thank you, Gabrielle. At this time, we'll give you one more opportunity to ask any questions you may have of her. And then, if no one has any questions, let's check the chat. We will see Courtney with UAB Beacon. Hey, were you able to get in touch with she, or is she still traveling?
She is still traveling. I have not been able to get her.
Okay, that is perfectly fine. I just wanted to check with you before we concluded and give y'all that opportunity.
Thank you.
Yes. So at this time, I would like to say again to everyone, thank you for joining us. We hope that you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Again, this meeting is the first and third Wednesday of the month, so please join us on the 17th of this month for our next virtual meeting, and I hope everyone has a wonderful day. Thank you.